Hello, everyone. Welcome to Health Series podcast. Today, we're going to be looking at a very interesting topic, the healthcare system of Nigeria versus that of India. Comparing the healthcare system of Nigeria and India reveals several interesting contrasts in terms of infrastructure, policy focus, financing, and healthcare outcomes. Both nations are characterized by large, diverse population and face challenges related to health inequalities, but they approach healthcare with distinct strategy. Looking at the area of healthcare infrastructure, Nigeria's healthcare infrastructure is fragmented and under-resourced, with a strong urban-rural divide. While some urban centers have tertiary healthcare facilities, rural areas often lack basic services, and healthcare centers may be far apart, making access more challenging. The private sector provides large portion of care, but it's mostly unaffordable for low-income populations. Public facilities, although available, often lack essential resources and equipment and personnel to work with. In India, on the other hand, has a more extensive healthcare infrastructure that includes a three-tier system, just like Nigeria, to serve rural-urban populations. However, similar to Nigeria, disparity exists between urban and rural regions, and the quality of care varies significantly. Major urban centers have advanced medical facilities that attract both local and international patients, while rural areas rely on primary healthcare centers that may face shortages in staffing and supplies. India also has a strong network of private healthcare providers and play a key role in providing health quality but often expensive care. In the area of policy and governance, Nigerian healthcare system is largely decentralized, with federal, state, and local government sharing responsibilities. The National Health Insurance Scheme was introduced to provide accessible and affordable healthcare, but coverage is limited and remains low. Policy frameworks in Nigeria focus on primary healthcare and universal health coverage, though these objectives face implementation challenges due to funding and governance issues. Epidemic outbreaks such as malaria and cholera put additional stress on the system. On the other hand, India's healthcare policy emphasizes universal healthcare coverage through initiatives like the NH Mission and Ashman Bharat, which aims to enhance primary health care, improve maternal and child health, and provide financial protection for hospitalizations. Ashman Bharat is one of the world's largest government-funded health insurance schemes, covering millions of economically disadvantaged families for secondary and tertiary care. While implementation is still uneven, it has brought some level of healthcare access to previously underserved communities. In the area of healthcare financing in Nigeria relies heavily on out-of-pocket expenses, while on only a small portion funded through public spending. Health insurance coverage is limited, with less than 5% of the population covered by NHIS, which is primarily available to the formal sector employees. Limited public financing, high poverty rates, and inconsistent budget allocations have hampered Nigeria's ability to expand healthcare services equitably. India, on the other hand, also relies significantly on out-of-pocket payments, which constitute nearly 2/3 of healthcare expenditures. Though public health funding is gradually increasing, Ashman Bharat offers insurance coverage for the poorest and state-level schemes, further provide financial coverage. However, a significant proportion of healthcare expenditure still comes directly from individuals and families, leading to financial hardship for many people in India. Human resource and workforce is another area I would like us to compare for both Nigeria and India. Nigeria faces a significant shortage of healthcare workers due to inadequate training programs, low remuneration, and immigration of qualified personnel and professionals to higher income countries like US, UK, Canada. The doctor-to-patient ratio is very low. There is a concentration of health providers in urban centers, further exacerbating access issues in rural regions. Efforts to address the workforce deficit have included initiatives to incentivize healthcare workers in underserved areas, though progress is slow. India also faces challenges in ensuring an adequate and well-distributed healthcare workforce, with disparities in rural and urban availability. Training institutions are expanding, and several policies aim to recruit and retain health professionals in underserved areas. However, India faces substantial doctor-patient ratio gap, and unregulated practice of informal health providers is also very common in rural areas. In the area of health outcomes, Nigeria faces high rates of maternal and infant mortality, high prevalence of infectious disease, and a growing burden of non-communicable diseases. Immunization and life expectancy are lower than India, and however, outcomes are adversely adversely affected by factors such as poverty, limited access to clean water, poor sanitation, and the rest. Nigeria has made progress in disease-specific areas such as HIV, AIDS, but overall health indicators lag behind for many countries. On the other hand, India has seen significant improvements in healthcare outcomes since recent decades, with a reduction in maternal and infant mortality rate, a decline in infectious disease burden. The non-communicable disease burden is rising, and lifestyle-related health issues such as diabetes, hypertension are increasing. India has a more extensive immunization program and higher lifespan expectancy than Nigeria, though disparity in health outcomes persist based on socio-economic and geographical factors. I would like to conclude by saying that both countries struggle with financial healthcare equitably, rural-urban divides in access, and over-reliance on out-of-pocket payment. India's Ashman Bharat scheme and telemedicine initiatives serve as models of innovation in healthcare financing and delivery. Nigeria's efforts to strengthen primary care and improve health insurance coverage are steps towards achieving a universal health access, though scalability and funding remain critical issues. Indians generally, on the other hand, achieves better health outcomes than Nigeria, partly due to broader coverage of immunization program, better infrastructure in cities, and higher public awareness. Nigeria's healthcare system still faces more significant challenges with infectious disease and under-resourced infrastructure. Finally, while India's healthcare system has achieved a broader scale of coverage and relatively better health indicators, both countries, I mean Nigeria and India, must continue to address financial, logistical, and policy challenges to improve health equity and outcomes for their populations. We would appreciate if you like the video. We would like you to subscribe to this channel so we can reach more listeners like yourself. Until next time, stay informed, stay healthy, and continue to explore the world of healthcare with us. Thanks for listening.
This podcast is sponsored and brought to you by HealthShare Integrated Solutions.